The COVID-19 pandemic has changed the way we work, live, and function as a society. As we learn more information about the virus, healthcare professionals are on the front line working hard to help the public as much as they can. Even in such an uncertain time, pharmacists such as Mayank Amin from Skippick Pharmacy are trying to spread positivity as much as possible.
Obviously, COVID-19 is not something fun or exciting. Needless to say, it's very scary. But I'm always someone that's optimistic, and I always try to see the positive light in whatever we can do to help someone else. And for me, it was trying to find a way to bring a smile to someone else's face in a time of chaos. And that's where the whole idea of Supermac originated. So that the first night the first day I walked in with a superhero costume, patients just walked in and you saw everyone just like, they were talking amongst each other and they were pointing and they were laughing and they were smiling. You could see that even amidst the chaos, that there was a sense of comfort, knowing that things would eventually be okay. And it wasn't until that night, after I finished filling the prescriptions, that I went out in the neighborhoods to make some deliveries. That hasn't changed since the year that I started this pharmacy. And I actually personally like going to deliver prescriptions to patients' houses because I get to know them and they get to know me. Obviously, with no contact in place, it was more so a drop off and then ring the doorbell. To my surprise, I actually had no idea, but I was being recorded by a Ring camera. I made a drop off, rang the doorbell, got back in my car, and just proceeded to make my way to more deliveries. And then someone posted on Instagram an hour later, say, "How does your pharmacist deliver?" And then it had a picture of me ringing the doorbell with my superhero costume on, and that went viral pretty quick. But it was exciting to see, and you saw that so many people were happy to know that there's people out there that are willing to go the extra mile and kind of do anything possible to make someone smile. But I think there's more to pharmacy now, and that's building that relationship with the patient, having them understand that you are there for them. You are their front line. When someone has an emergency, last night a patient had an issue. She had to go to the urgent care. The nearest 24-hour pharmacy from us is about 45 minutes to an hour away. She texted me on our pharmacy's texting line, and I saw the message. Lo and behold, I was out making deliveries 12 o'clock at night. That's what we do as independent pharmacists. I was making deliveries, and I texted her back. I said, "Head to the pharmacy in 15 minutes. I'll be there. If you can't come out, I'll drop it off to your house." And went back to the pharmacy, gave her her med. So we don't do this for accolades or acclaim. We do this because we care. And there's thousands of stories, and this is the time, I think, pharmacists throughout the country, it's your time to rise, not for fame, but to be able to help your community and to let them know that you're here for them, and kind of be there to assist them throughout this whole process, because it's not going away anytime soon. At least I don't think. I think this is a new part of life until a vaccine or something is developed. Independent pharmacies have been here, but now with this virus here, independent pharmacies have kind of stood up and said, "Hey, we're here for you guys. Doesn't matter if no one else immediately in the left or right of you is, but we're going to stand up. We'll be here till midnight to help you out. We'll drop off your med at 3 o'clock in the morning." Why? Because we care. And that's what the communities are starting to realize. And a lot of my friends that are independent pharmacy owners throughout the country, they're literally going above and beyond, risking their lives, putting themselves in the forefront, because that's what we do as community pharmacists. We care.
Even with the adjustment to utilizing new services and ways of delivering patient care in the pharmacy, including the emergence of telehealth services, pharmacists across the nation have found ways to operate successfully, such as Jennifer Zilka, Senior Vice President of Good Neighbor Pharmacy.
So Good Neighbor Pharmacy is a family of thousands of independently owned pharmacies throughout the country, and they're really tailored to kind of improving the health of their unique communities. So think of everywhere from rural America all the way to urban, New York City type independent businesses. So we've seen them work really hard to operate almost as a closed door pharmacy. Many have opted to protect both their staff and their communities, to operate utilizing their curbside, so running prescriptions out to the curb and interacting with patients through the car window, their drive-through, and through delivery services. So 76% of our pharmacies already offer delivery, So now they're expanding on those services, maybe delivering a little bit further, sometimes checking in with elderly patients. Our Good Neighbor Pharmacy owners, their business is typically about 42% Part D. So a very vulnerable population, especially right now in terms of COVID. So they're taking the time when they deliver the orders to check in, to see how those patients are faring, and just really utilizing that personal touch as much as they can. You know, I as a consumer have gotten somewhat accustomed to curbside pickup with my local restaurants and things like that throughout this process. So it may be something that has legs beyond COVID. But yeah, they've done a phenomenal job with curbside, and then some other just really, I think, I have the beauty of a job where I get to talk to independent pharmacy owners, all day, every day. And some of the things that they're doing are so heartwarming and I think lifting during this time. But some of them are offering free meals to their community. So you can walk up to a tent, get a simple lunch from 1 to 3, and providing that to their community. They're compounding hand sanitizer, and they're delivering that to nursing homes, to police departments, fire departments, EMTs. So just a really special way that they're really engaging with their communities and helping out. One pharmacy, I love this. She went out on Facebook and Instagram and encouraged her followers to make cards. So a lot of kids are home from school, so they're making these cards. And she has generated over 500 cards. So she's sending the cards to healthcare workers on the front line, to some of their elderly patients that they service. So food drives, COVID-19 care packages that they're dropping off for elderly patients. So just a lot of really amazing kind of community spirit is happening there, that they're doing that so far above and beyond what you would traditionally think of going to a pharmacy and getting your prescription. So it just speaks to, I think, the role that they play in their communities and how important they are to the community that they serve. Inherently, these pharmacy owners, when you ask them kind of why they do what they do, they almost have a hard time answering it because it's just who they are. So providing that care, while it's been challenging and probably, for many, some of the most challenging times of their career, they definitely get that reward mentally by caring for others, because that's just who they are. They're the most empathetic people I've met.
Outside of the retail setting, pharmacists in places such as emergency medicine have been facing a majority of different challenges in their practice, including Catherine Sami, emergency medicine clinical pharmacist from Sarasota Memorial Hospital.
I definitely think this is going to be the strangest thing that's ever happened in my career. I know I'll look back and just remember this was such a strange time. I feel like up until this point, I worked really hard to be at the bedside, clinical, really involved in the care of the patient, right next to them. And I feel like right now there's like this strange movement where I'm having to step back a little bit. So I'm trying to conserve PPE. So maybe I don't have to be gowned up in the room at the bedside. But it's strange to round on your patients and look at them through a glass. And that has been like, I have this strong sense of care for my patients still, but it's so strange and odd to look at them through glass doors. So that's been interesting. And then another big piece is that we always think of this as clinical pharmacists. We're always thinking about logistics, but I feel like even more now, every med is not only a clinical concern, it is a dire logistical one too. So will this be an extra gown that has to be used in face mask? Or can we use extension tubing to run some of the drugs and pumps from outside of the room so the nurses don't have to go in as frequently and titrate? Can we time the meds more closely together so that they're only going in at less number of times versus having to go in at 2 o'clock for this med that's scheduled and 5 o'clock for this med that's scheduled? So recently at our institution, a medication like warfarin used to be scheduled at 5 p.m. We changed it now to be on time with some of the other administration of meds a little bit later in the day. And that was to reduce the number of exposures to the nurses and then also just conserve PPE. I definitely think our hospital's trying to be transparent about what we have. I, as someone on the front lines and not in an administrative team, I feel like I'm getting regular updates about what we have and how to conserve. But I also feel like what I'm supposed to be wearing at any given time has changed a little bit as we determine just how airborne this pathogen is. So that's been kind of scary. I'm just really hoping we don't get to the point where the shortages are so bad we have to start making really difficult decisions, like who gets to wear it, who doesn't. And I'm hoping there's some really good, innovative solutions in the works, or like how some of these companies are starting to change what they would typically do, like how Ford is trying to make ventilators. Like I'm hoping that some of that will ramp up production and we'll start to see some PPE come in.
Methods of prevention have been put into place all over the United States to further prevent the spread of COVID-19 until a vaccine is developed. As for when the vaccine is finally launched, pharmacists will be playing a big role in administering the immunizations, according to Stephen Anderson, CEO of NACDS.
We have 330 million Americans in this country, and we don't know how much vaccine is going to be available, how many types of vaccines that are going to be approved that the American people will be able to have available to them. It's anticipated that the most at risk among us in our population will be immunized first. And, the question is, how long is it going to take to get the general public immunized? We don't know the answer to any of those questions quite yet. Pharmacists are playing a large role in preparing ourselves for the COVID vaccine once it's available. We have to reduce regulatory barriers and really, have everybody that that is implementing these decisions understand the value of pharmacy and what we can do. We talk about the value of pharmacy all the time, and now the American people are seeing that. They saw that value when this became a public health emergency, when the president was in the Rose Garden and declared it a public health emergency, and we had NACDS member companies standing there and committed to doing COVID testing. And that was not without challenges due to shortage of PPE equipment, shortages of tests, and we're still struggling in this country to do the tests. But our pharmacists have really stepped up to the plate, and the American people are seeing that value.
After months of research and expedited clinical trials, more details about the vaccine have been revealed to help ease uncertainty surrounding the immunization.
As we understand it, some of them are going to have very low holding temperatures. I heard a number the other day on one of the vaccines that could be 120 degrees below zero. There's an infrastructure there that will, we have an infrastructure to deal with vaccines, but there will be challenges that our member companies are going to have to overcome. But from the members that I talk to, they're ready to go. And, and I have to say, when we say ready to go, I really want to pay tribute to, the pharmacists who are on the front lines on this issue and other people within the store and have been since the COVID pandemic came upon us. We represent not just traditional drugstores, but we also represent the grocery stores and the mass merchants. So basically any retailer with a pharmacy. 91% of the American people live within 5 miles of one of our member company stores. We are the most accessible healthcare professional in the country. Many times we're the only healthcare professional in many communities. And, we've experienced and we've seen the disparities of health in this country as it relates to minority ethnic populations and others. The Black and Latino community has been hit particularly hard. And Gallup does a survey every year on the most trusted professions in the country, and pharmacists are always in the top 3. We're in good company. We're with nurses and physicians. And the American people, and particularly the minority community, trust their pharmacists for their advice and guidance. The Centers for Disease Control and Prevention found that 80% of the nation can be vaccinated 7 weeks sooner when pharmacies are used as part of the deployment of the vaccine. So it's going to be, we don't know what vaccines are going to be available right now. We're in, stage 3 trials on several of them, and but we're working to prepare now. So once the vaccine is available, when it's safe and it's effective, that pharmacies will be ready to go to provide those COVID vaccines.